usually come in for a consultation. We're looking for a medical history, a surgical history, allergies, medication reconciliation. And the most important thing is what the woman has been going through, as far as her periods, any bleeding issues, any pain associated with her cycle, urinary frequency, constipation. We're asking all of these questions to find out if these symptoms are in fact due to the uterine fibroids. Much of the time, the patient comes in with prior testing. They already do know that they have fibroids. However, there are times that we do get patients that have seen advertisements. They've said, oh, I've been suffering with this for a very long time. It has to be fibroids. And we're happy to investigate into that to see. So typically, ultrasound is used for diagnosis of the uterine fibroids. So a lot of the time, the patient already has prior testing and they're being referred by their GYN. They already know that they have fibroids, and now we're at the point of providing options to the patient. Then there are times where they find us on social media and they say, I know that this is what I have. My mother had a hysterectomy. My aunt has fibroids. I just know that it's something that I've been dealing with. I just haven't officially been diagnosed. We're happy to send the patient for an ultrasound in order to determine whether they do have that. And then, of course, we move forward with an MRI, which is our gold standard prior to doing any kind of treatment. So we do need an MRI in order to find out the size and the location of the fibroids. So if the patient has already had an ultrasound, you can just give them a script for an MRI, and then after that, we're able to really put that whole story together. That ultrasound is going to be that one extra step if somebody does not have prior testing, which is fine. Then we explain the procedure. I think that this is, taking time out to really explain the procedure and to really discuss with the patient what's going to help them and help them determine whether this is right for them, is really important. We do a lot of time for a uterine fibroid consultation. The patient has been going through a lot. It's a very emotional process. We're very supportive in that sense. And so providing options, making sure that this would be the best option for them is something very important to us. So after discussing that and determining whether or not they want to move forward with it, we're able to provide a pre-operative instruction telling you, what medications to continue, what to stop prior to undergoing the procedure itself. We wait for authorization from the insurance company, and then we're able to just move forward. So, I like to say, hopefully before your next period, we'll get this taken care of. And it's very rewarding in, for uterine fibroid embolizations.